Patients DB presents a system built by healthcare professionals for healthcare professionals. True costs and case operating margins. A better way to manage and maintain financial stability. First, a little background on where the system came from. We built Patients DB for ourselves, healthcare professionals on the job, in a busy hospital, facing the same problems you face every day. We couldn't stand not knowing the profitability and true costs of every patient we saw every day. Nothing on the market could do that. So we built Patients DB ourselves to show us a P&L statement on every patient. Every day we saw where we could be more efficient, cut costs, or improve revenue opportunities for the hospital. A new way of looking at finance, through the eyes of the healthcare professionals in the patient care setting. It also managed our scheduling, compensation, and department budget process. Our experience with Patients DB was very positive, fast, easy, customizable. We used it every day to know how we were impacting the bottom line. Now we think it could help your hospital too. Let's take a look. Have you ever thought about how your financial reports look to your healthcare professionals? Outdated. Like spam. Too much work to understand. And not relevant to the job they do every day. A PDF in their inbox? Delete, straight to the trash bin. But you need your entire team on board if you want to win this game. So what do your healthcare professionals really want to know about finance? Not what the department did. Not what the whole hospital did. Not gross revenue, not charges, not volume. They want to know about how they impact their patients and how the job they did affected the bottom line of their hospital. You already do financial reporting. So what exactly is the problem? Standard GL accrual accounting just can't tell your professionals what's really going on. They can't tell how efficiently they provide their own services. Healthcare professionals, nurses, doctors, aides, social workers, technicians, PAs, clinically well-trained. Check. Operationally can do. Check. But on how they're impacting your bottom line? Barely the foggiest idea. There is a better way to show what's going on. And Patients DB can help you do it. So, financial reporting problems. There are several. Standard accounting, using static budgets. Patient care is fast-paced and nonstop. But standard GL department accounting is by nature slow, and the budget evaluation occurs only periodically. By design. Is that the right design for your financial reporting? About as wise as glancing at your front windshield, only periodically. Revenue, or revenue versus cost. What really threatens financial stability? What's beneath the surface? Hospitals have been revenue-focused for decades. Such a priority, there's even a special name for it. Revenue Cycle Management, RCM. But with revenue slowing down and new cost risks popping up everywhere, focusing solely on RCM is risky. Declining reimbursements, surging costs, bundled or fixed payments, threats to Medicare and Medicaid, imprecisely negotiated contracts, margins. Margin, not RCM, will be the key focus going forward. So let's focus on margins for a change. Managing your margins depends very strongly on effective management of costs, for both labor and supplies, right down to the patient level. Net revenues and true costs. Every patient, every day. Information about patient costs and margins ought to be communicated daily between your healthcare professionals and your financial managers. Providing relevant metrics isn't magic. It's knowing what to show. And when old solutions from established mega vendors aren't solving the problems you have today, then maybe it's time to consider something better. Patients DB is like having really clear sonar depth finder. You see the rocks coming in the form of hits to your margins, one patient at a time, in every department. You know your depth and hence your margin, and can plan and adjust your budgets as conditions change to inform your rolling budget process. Patients DB makes your financial information relevant to the professionals who actually do the job of providing the service. Your frontline professionals are in a great position to help you avoid risk, understand the financial impact of operational decisions, and steer towards efficiency and solvency. A P&L statement on every patient that ties out to your enterprise financial statement and GL. That's what Patients DB is about. Making information available to the professionals who actually do the job of providing the service. more accurate, more timely, more agile. A solution for managing margins, true labor, and supply costs and revenues at the same time. A better way to inform your rolling budget process. A light, non-capital SaaS expense, either on-site or hosted in a HIPAA-compliant cloud. Patience DB. Try before you buy. Ask us for a trial free of charge. Email us at info@patiencedb.com. Patience DB. Operational Management and Accounting. Simplified.